I'm Dilbar Kang from Omni BC. As the COVID-19 pandemic continues, we had an opportunity to chat with BC's Provincial Health Officer Dr. Bonnie Henry and Health Minister Adrian Dix. Omni BC asked them questions about COVID-19. All of the questions were submitted from our viewers and focused on COVID-19 from the Punjabi community's perspective. Dr. Henry, what is your take on the situation of COVID-19 so far? Did we flatten the curve?
You know what? We have done very well here in BC, thanks to everybody doing their part. And we have indeed flattened our curve. And that is the good news. The challenging thing is that it hasn't gone away entirely. We are still seeing people getting sick with COVID, and we still have to keep up those measures that keep us all safe.
Dr. Henry, we are still not able to have social get-togethers as we having usual. Can you clarify our audience how much we should be expanding our social circles with family and friends?
You know what? That's one of those things that is still a risky situation for us. So the limit of 50 in having a group, if you have a large enough space, is going to stay in place for at least the summer and the coming months. So that's one limit if we're having parties or celebrations, making sure that we keep the numbers small. That's very important.
What we've tried to do in BC is to have relatively few rules, but we needed people to really respond. And if you look what happened in the middle of March, the rules that came down, but also the work that we started to do together, it was extraordinary in BC, really, how people responded to those. And they responded because they cared about their mothers and their grandmothers, their fathers and their grandfathers, their brothers and their sisters, their friends. And they've taken the action that we've needed to take. So we have seen a flattening of the curve. What's also true is that there are still cases. There are cases every day, particularly as we've seen in the last month in the Fraser Health Authority. So we have to continue to keep those steps. Physical distancing, staying apart from each other while we interact and work together and sometimes play together, but staying far enough apart saves lives, and we have to continue to do it.
Dr. Henry, it is a wedding season and Indian weddings are week-long events with several celebrations. Keeping the 50% maximum and social distancing measures in mind, what does a safe wedding celebration look like? And should events be at home or outside?
You know what? Weddings are wonderful, joyful celebrations, and they're important events in our lives. But we have to do them differently in COVID times, unfortunately. And that means better to have smaller numbers and make sure that you can keep those safe distances between people. We also need to think about ways of letting people participate who might be at higher risk of getting sick or having severe illness with COVID-19. So that's people who are older, people who have underlying health issues, and finding ways for them to be able to participate remotely so that they're not put at risk. And that's how we keep our families safe. So I think we need to look this summer, in particular for weddings, making sure we know who's there. Outside is safer than inside, and if it's a small space, you need to have smaller numbers, and making sure that we can do those important, joyful celebrations in a way that keeps people safe in our families, the ones that we love the most.
Dr. Henry, when we're talking about the wedding celebrations, there's lots of communal food and dancing as well. Should this be axed altogether, or is there a way of going about it safely?
I think there's ways of going about it safely. So, you know, if you're in your family group can dance together. They're the people that you have contact with. But we want to make sure that that's not too large and that we're making sure that anybody who's feeling unwell does not go. And then for food, there's ways that you can do that safely as well. We can apportion it out so that people aren't using the same containers, making sure that they're not exchanging and clustering close together at a buffet, for example. And we've seen many ways that people have been able to do this and still have those celebrations.
What are the rules for places of worship? What people should keep in mind when they go for prayers?
You know, we've had a number of meetings with faith leaders from all faiths around the province, and I'm also very grateful for the leadership that they've shown and how to help people have those very important celebrations and prayers in a way that is safe for people. So again, we look at smaller numbers and having space between people, and the 50 is the limit for if your space is big enough to have 50 people together. But those are things that we have seen people doing really effectively, and being able to include people even with the limitations on actually being physically together. We can be spiritually together without having to be together physically.
What are things to keep in mind when you go for grocery shopping? What do you recommend doing? What protocols should you have in place with the food and packages when you return back home?
Yeah, so we've been learning a lot, and these are strange times. They're very different in pandemics, in the pandemic time. So what we've learned in grocery stores, I think we've all figured it out, that making sure that we're lining up, that we're not having close contact, that we have barriers in place, and there's lots of things around going certain one way down aisles so that we're not clustering together. These are things we all need to follow, and it's another occasion where wearing a non-medical mask can be helpful, and making sure we have barriers between the checkout and between people in the lines. Those are all things that we're getting used to, and it took some time, but I think we're doing pretty well with it now. So the other things that are important around food is we know that this virus can get on our hands and that we can get sick by touching our face. So making sure that we clean our hands regularly and make sure we don't touch our face when our hands aren't clean. Same thing applies to fruit and vegetables when we bring them home. It's always a good idea to wash your fruit and vegetables, because we know there's lots of bugs that can get on them from the grocery store. And then clean your hands. So those are the key things that are going to keep us safe.
Minister Dix, is it safe to visit the doctor and hospital?
Absolutely, and people have started to do it. A couple of things. First of all, we started on May 7th, we announced, and on May 18th, we started doing scheduled surgeries. We've been contacting tens of thousands of people, and some people are nervous and have wanted to delay their surgery further. But overwhelmingly, people are scheduling their surgeries, and those surgeries are being carried out, and it's just an extraordinary thing that's happening in our healthcare system, which is getting back to normal on surgeries. In terms of emergency rooms, if you need to go to an emergency room, it's safe to go, and you should go.
You can watch our conversation with Dr. Bonnie Henry and Adrian Dix online at citynews1130.com. For City News, I'm Omni BC's Dalbar Kang.